it's never been more important to help people make sense of their lives, to increase awareness of the value of imaginative processes, of the richness in imagery, the richness in story, the richness in all the arts.
Art as a tool for self-expression, you know, because one of the things I love about it is that, you know, everybody is born into the world and we're born into a society and there are rules and regulations and you know, we must learn to live in this society, but what we need to do and have to do at times and what we want to do or what we feel may be quite different, and that can create some conflict. So we're not always free perhaps to say or do what we might like. And I think when you sit in front of a blank page, now there you have freedom, because nobody can say, I want you to draw it this way or this way. You're free to express yourself as you see fit on that page. And it's quite a safe method of self-expression. So it's a good place to explore maybe that which is not so easily explored in the ordinary everyday, or the conversation you can't have in the pub, or the conversation maybe that's not so easy to have when you're with the sheet of paper, you know, perhaps those things are more easily expressed.
An introduction to a non-verbal right brain approach is really incredibly important if young and those early theorists were right about it. We just can't study the human psyche without taking creativity into account, without looking at the arts in general. Eric Fromm reminded us that psychotherapy isn't the only way to study the human mind, that you could go out there and read some novels, and the classic novels, the Greek myths, all have, there are other ways and other really important ways of understanding the human psyche. Not to have an approach, to provide a training without an approach that has this whole dimension of the imagination and creativity, we're leaving out a hugely important layer of the human experience and the human psyche. Carl Jung, as Liz has already mentioned, is often considered the forefather, the founding father of art therapy, and he really reminded us that you can't really study the human psyche without bringing creativity into it. There are as many approaches and theories for art therapy as there are approaches to psychotherapy. So you have a Gestalt approach, you have the person-centered approach, and now we have a whole, the evolution of the expressive arts therapies movement as well, which stresses the importance of moving from one modality to another, which is enormously freeing and valuable for people who are open to it.
And I think on a very practical level, post-Second World War, in the hospitals with soldiers who were suffering from what would now be called post-traumatic stress, then it was a thing called lack of moral fibre or whatever. But there was one, Adrian Hill, a man in England who had been an artist and had actually been involved in the war, was recuperating in hospital and started drawing, in order to help himself with the recovery, and really noticed the benefit of this for himself and encouraged other people then to get involved. So there was a very recognised movement in England of artists working in the hospitals and then moving into mental hospitals as well, where people were left at that time with very little to do perhaps. And there's a very moving story about one artist going in and a patient giving him, it was a piece of toilet paper and he'd drawn on it with the matchstick because they were the only materials he had. So clearly there was a tremendous need for people to express themselves, people who were marginalised and maybe not able to verbalise where they were or what was going on for them, but clearly there was a need for them to express themselves in some way. There's also very famous outsider artists, they would be called now, you know, who worked in hospitals in Europe as well. So there's a very rich history with that, and I suppose people like Carl Jung and that opened it up for
others
as well to develop it and
yeah,
put a framework around it. But it was starting to happen quite spontaneously in these different areas, that people saw the value of it without maybe being able to say why.
There's always this argument, you know, what is art? What's the difference between art and art therapy? And of course there is no one defining answer to that, because a lot of art per se is therapeutic anyway. But you know, we're always encouraging people for the first time not to worry about making a picture look beautiful or mean anything, just to explore the materials in the way that children do. Of course the theory is really important, but we may not emphasize that when we're working with clients, but for the therapist, for the art therapist, yes, it is of course very important. Yeah. The emphasis on the theory will vary a lot, because you're not going to be talking about theory when you're working with children.
Yeah.
But if you're working with a trainee who wants to do some personal development through art therapy, they'll be naturally curious as to why you're doing this exercise and so on. And anyone who is open to working creatively, who is curious about it, who I suppose, you know, who is open to the increasing awareness of how much we over-rely on left brain approaches in the Western world, and the importance of balancing that with right brain activities and ways of processing experience. Because I'm so passionate about bringing creativity into my work, and because it's such a fulfilling and rewarding experience seeing what students get from that module as well. We've been talking about, well, just how much happens before you ever put a mark on the page.
Yeah.
And people will only get that by experiencing it and processing it. And you know, I think it's Joy Shavarian, who's a Jungian art psychotherapist, talks about, you know, that moving balance between the 3 P's of process, product and person. So that is very important to always be aware of. Sometimes you need to pay attention to what's happening for the person, who's obviously the most important. Sometimes it's easier for them to talk about themselves through talking about what they're making or what they've made. The importance for the therapist to be very tentative, sensitive. All of those qualities and skills can only happen if you understand what you're asking your client to do from having had that experience yourself.
It's one of the really interesting things about art therapy, even if somebody does a picture and they may feel a connection with it and they may look at it. And I know I've certainly had this experience myself of making a picture and thinking, oh, I really like that, you know, thinking, but what does it mean, you know, and thinking, I have no idea, you know. And then maybe 2, 3, 4 months later, you look at it and you think, now I can see what I was making there. But in the moment, perhaps you can't, and we have to respect that too, that you can't always understand it. It's not A is equal to B, A plus B equals C. It's not like that. It's a process. There's no doubt that images precede words, so people will often have a felt sense of something and know it at quite a deep level. They may not be able to articulate it or verbalize it, but they may put it in a picture in a symbolic way that they can't quite yet understand. But then in time, when you look at it, the words may come and you can think, well, I knew this all along, but I just wasn't able to say it, you know. So pictures can hold a lot of meaning, and that in itself can be therapeutic. The fact that somebody can make an image, look at it, see it and feel satisfied and know that this is important and there's something really important here. And I don't know what it is, but they can live with that image and it can speak
It's
back to
okay.
them, and that's okay, because it's like whatever it is that's important is held somewhere safe for the moment, and they don't have to carry that, you know, conflict or struggle or whatever we name it, feeling inside themselves. It is now externalized somewhere else, and that works quite a lot then for children, because they don't have the language to verbalize maybe a lot of what's going on, but they have the ability to make images, and these feelings can be contained and held in the images. So that's a really important way that art therapy functions to help people move through difficult experiences.